Hi, my name is Alicia. I graduated in 2020 from Rice University in Houston, Texas, with a bachelor's in cognitive sciences and a minor in poverty justice and human capabilities. With funding from InterExchange Foundation's Christianson Fellowship, I've been working remotely on a systematic review with the Global Tuberculosis or TB program at Baylor College of Medicine and Texas Children's Hospital. So, a systematic review is basically a comprehensive summary and evaluation of a particular focused research question. So, for us, we focused on the strategies used to promote children's adherence to TB medication. Adherence to TB medication is often challenging because the side effects are often unpleasant, and at the same time, the existing treatment regimens usually last for months. There is currently therapy available for people with active TB as well as people with latent TB infection. So the difference here is that people with latent TB have been infected by the same bacteria that cause clinical TB disease, but they don't feel sick and they don't have the symptoms. And at some point, a percentage of those with latent TB, especially those with weaker immune systems, will go on to develop clinical TB disease. And the idea here is that there's TB preventive therapy that can be used to help stop progression from latent TB to clinical TB disease. Young children are more likely to develop more severe forms of TB disease, and they are also more likely to die from TB. Even so, they're often overlooked in national TB programs, and this is why it is especially important for us to do a systematic review of the existing strategies to help promote children's adherence to TB treatment. So we've learned from our systematic review that existing strategies to promote children's adherence to TB treatment can be categorized into three types of strategies. One is health system directed support. Two is treatment directed support. And three is patient directed support. So examples of health system directed supports include a TB register system that keeps track of TB patients, their progress with TB treatment, as well as household members who may be at greater risk of contracting TB. Examples of treatment-directed supports include shorter treatment regimens. So currently, sort of the standard therapy for latent TB infection involves taking medication every day for 6 to 9 months. However, more recently, there have been studies looking at shorter regimens that usually go for 3 to 4 months. And finally, patient-directed supports. Some examples of that include providing patients and their families with socioeconomic supports like food packages and transportation tickets. So we'll be able to go in more detail about our findings in an upcoming article, and we look forward to sharing more about our findings there. So even though I was working remotely, I still had the opportunity to meet with and learn from researchers in eSwatini, South Africa, Germany, and other states in the US. So at a virtual retreat, we had the opportunity to present updates in our work, and each researcher took the time to explain the methods and motivations guiding their research. I thought it was really cool that people were very upfront about the potential limitations and conflicts of interest in their study. Shri is a med student who has been working with me on the systematic review. Shri and I are the two youngest members on the team. I just really appreciated the fact that other team members who've had years of experience in TB took the time to listen to our updates and provide feedback based on their own experiences working with patients and communities in the field. And finally, I was just so impressed with everyone's adaptability. We were attending the virtual retreat from different time zones. And specifically in Eswatini, internet is known to be slow and unstable. And I was just impressed by how the Eswatini team members were able to account for any sort of potential blips. So, all in all, I'm just so blown away by my team members' adaptability, humility, and transparency. And these are all characteristics I'm still working to develop professionally and personally. So, when I attended the Global TV program's virtual retreat, I had the chance to learn about all of the up and coming research from our collaborators in Eswatini, South Africa, Germany, and the US. One of the most interesting updates came from researchers in Eswatini. These researchers are looking into using stool as a way to diagnose TB in children. And diagnosing TB disease in children to this day remains very challenging. In fact, 55% of children with TB are not diagnosed. And the reasons for this include it's really difficult to collect sputum specimens from babies and children. Sputum is basically the mucus that comes out when you cough. In addition to this, children oftentimes are more likely to have TB disease caused by a lower number of bacteria. So it's less likely for sputum test results from children to come back positive. Just really excited to see that researchers are looking into alternative ways, such as stool collection, to diagnose TB in low resource settings, because stool is a specimen that can be more easily obtained from children. Working with Dr. K, Dr. Mandalakas, and other members of the Global TB program has cemented my motivation to sustainably address child poverty, to strengthen families and communities, and to ensure healthy development. Over the course of working with the Global TB program, I've learned how to more effectively evaluate and also synthesize scientific research. In addition to that, I've learned to share my work in an approachable way to other researchers and healthcare workers. However, I think my greatest takeaway from all of this has been the importance of building a community and having a network of motivated peers and mentors. This experience has also taught me to prioritize health equity and social justice in my own medical education. I've learned how to embrace discomfort and to speak more directly about oppression and privilege and their impacts on health and well-being on the local and global scale. As I'm preparing to start med school this coming fall, I've heard from students and practitioners about the burnout that can come with working with the most vulnerable patients in a constrained, broken health system with limited resources. So I think it's particularly important to set up a space where we're able to share our fears, our challenges, our victories with a supportive network.